Welcome to Visual Diagnosis. Now let's talk about aspects of complexion color. Letter A, superficial or deep color. Observation. The differentiation between superficial and deep color is based on the depth of the complexion's color. A color is defined as superficial when it is seen clearly on the surface of the complexion, while it is defined as deep when it appears to be a level below the surface. This man has a red superficial complexion color because, as we can see it, the red color of his face is clearly seen in the surface. Okay? This man has a red deep complexion color because of the red color of his face appears to be a level below the surface. Chapter 49 of the Spiritual Access says, the 5 colors are present in certain areas of the face. Recognizing whether the colors are superficial or deep helps us to understand the shallow or deep location of the pathogenic factors. The chapter keys to the 4 diagnostic methods in the golden mirror of medicine says, the deep color is relatively dark. It indicates that diseases are deep in the interior. If it is also obscure and lusterless, it indicates that diseases are chronic and severe. The superficial color is relatively light. It indicates that diseases are on the exterior. If it is also bright and lustrous, it indicates that diseases are mild and newly occurring. The chapter outline of the 10 methods for recognizing Qi in the book says, the superficial color is shown on the complexion, while the deep color is hidden underneath the complexion. The superficial color indicates exterior diseases, and the deep color indicates interior diseases. If the color is first superficial and later becomes deep, it reveals the movement of a disease from the exterior to the interior. If the color is first deep and later becomes superficial, it reflects the movement of the disease from the interior to the exterior. Clinical significance. If the abnormal complexion color is superficial and light, it indicates that the disease is mild and is located to the exterior or in the young organs. It can be easily treated and the prognosis is good. If the abnormal complexion color is dark and deep, it means that the disease is severe and is located deep in the interior or in the yin organs. The treatment is relatively difficult and the disease cannot be cured within a short time. Chapter 15 of the simple question says, if there are changes of the colors in the upper, lower, left, and right regions of the face, efforts should be made to understand the location and prognosis of the diseases indicated by the respective colors. If the abnormal color is light, it implies that the disease is mild. Such patients can be treated with soups to nourish the body. They will recover in 10 days. If the abnormal color is deep, it indicates that the disease is severe. Such patients should be treated with a herbal decoction they will recover in 21 days. If the abnormal color is even deeper, it means that the disease is much more severe. They must be treated with a herbal tincture to regulate the circulation in the channels. They will recover in 100 days. If the color of the complexion is dark, haggard, vigorless, and emaciated, it shows that the spirit is gone. The disease cannot be treated, and such patients will die in 100 days. To summarize, superficial color indicates mild condition, and it is located in the exterior and in young organs. Deep color indicates severe condition. It is located in the interior and in the yin organs. Next is distinct or obscure color. Observation. The differentiation between a distinct and an obscure color refers to the quality of the complexion color. A distinct color is bright and clear and manifests itself readily, while an obscure color is darkish, dull, and lifeless, as if trapped inside the complexion. It is important to note that the differentiation between the distinct color and the obscure color of the complexion applies to any shade of pathological color, and both distinct and obscure colors are abnormal. For example, a pathological dull yellow complexion may be either distinct or obscure. So, the color of the woman's face on the picture is distinct red complexion color because, as we can see it, it is bright and clear and manifests itself readily. Okay? Now, the color of the face of the man in the picture is obscure red complexion color because it is darkish, dull, and lifeless, as if trapped inside the complexion. The chapter outline of 10 methods for recognizing Qi in says, the distinct bright color looks unfolded, and the dark obscure color looks gloomy. The distinct color indicates that the disease is of the yang type. The obscure color indicates that the disease is of the yin type. If the distinct color becomes obscure, it means that the disease has changed from the yang to the yin type. If the obscure color becomes distinct, it means that the disease has changed from the yin to the yang type. Clinical significance. If an abnormal complexion looks distinct and bright, it indicates that the disease is of the yang type. The location of the disease is superficial, and the upright Qi is not exhausted yet. If an abnormal complexion color looks dark and obscure, it indicates that the disease is of the yin type. The location of the disease is deep in the interior, the upright Qi is deficient, and the disease is severe. If in the course of a disease, the complexion color changes from distinct to obscure, it indicates that the changes is progressing from the yang to yin organs, which is a poor sign. If it changes from obscure to distinct, it indicates that the disease is progressing from the yin to the yang organs, which is a good sign. Okay? Now, in treatment, for patients with an abnormal but distinct complexion color, the emphasis of the treatment should be on eliminating pathogenic factors. For patients with an abnormal but obscure complexion color, equal emphasis should be put on eliminating pathogenic factors and strengthening the upright chi. To summarize, distinct color is of yang type of disease. It is superficial. Upright chi is not exhausted. Obscure color is of yin type of disease. Deep upright chi is weakened. Now let's go to scattered or concentrated color. Observation. When considering abnormal complexion colors, another differentiation is that between scattered and concentrated. The scattered color is thinly distributed and sparse, while the concentrated color is densely distributed and so this man's face has a scattered red color because it is thinly distributed and sparse. This man's face is concentrated red color because the red color on his face is densely distributed and aggregated. Chapter 49 of the Spiritual Access says, the observation whether the color is scattered or concentrated tells us whether the disease is a long way off or imminent. The chapter outline of 10 methods for recognizing qi gives a different interpretation of the clinical significance of the scattered or concentrated colors. The scattered color is thinly distributed and open. The concentrated color is densely distributed and closed. The scattered color indicates that the disease has had a short duration and is about to be alleviated. The concentrated color indicates that the disease has had a long duration and will gradually become severe. If the abnormal color is concentrated at first, but changes later to being scattered, it indicates that the disease is about to be alleviated, even though it has had a long duration. If the abnormal color is scattered at first, but changes later to being concentrated, it indicates that the disease is becoming severe even though it has had a short duration. Okay? Clinical significance. When an abnormal complexion color is scattered, this indicates that the disease is of short duration and mild nature. It will be treated relatively easily and the prognosis is good. When an abnormal complexion color is concentrated, this indicates that the disease is of long duration and severe. Pathogenic factors are strong, the treatment is relatively difficult, and the prognosis is less good than in the case of a scattered color. To summarize, scattered color indicates mild disease. It has short duration. Pathogenic factors are not strong, and pathogenesis is good. And so prognosis is good. Concentrated color indicates severe disease, long duration. Pathogenic factors, excuse me, strong, and prognosis is not good. Now let's go to thin and thick color. Observation. The differentiation between a thin color and a thick color is based on the thickness of the color. To understand this distinction, one should think of paint. The thin color corresponds to a single skimpy coat of paint, while the thick color corresponds to several heavy coats of paint. The picture of a woman's face here is an example of a thin complexion color. Excuse me. The picture of a man's face here is a thick yellow complexion color. Okay. Clinical significance. A thin color indicates a deficiency, while a thick color indicates an excess. That is, the presence of pathogenic factors. If the color changes from thin to thick, it indicates that the condition is changing from one of deficiency to one of excess. If it changes from thick to thin, it indicates that the condition is changing from one of excess to one of deficiency. Okay, now to summarize, thin color indicates deficiency, while thick color indicates fullness or excess. Thank you so much for your attention.